Good afternoon, everybody. Thank you so much for joining us today. This is me, Jennifer, from Silver 17 Consulting, usually a sourcer, but currently a host on webinars. And joining me is my partner in crime and collaboration, Jane Moores. Together, we run Touchbase, a space for people to get together to learn things, to know what is to be learned. Welcome, Jane. And also, of course, Renee Lazenby, our guest for today. We're super excited to have her here because we're all excited going back to work. And with this, over to you, Jane. I'll be handling the socials from here on outwards. See you on the side.
Thank you, Jennifer. You can see that she's a sourcer, super energetic and busy. She's normally researching, as she says, and I am normally training companies on interview skills and how to hire the right people. But as Jennifer said, for this time during lockdown, we have added webinars to our portfolio. We thought we wanted to be able to find a way to support our clients and friends as we all navigate this new normal. So one of the ways is to interview people who are experts in the fields that people are currently asking about. And of course, now as we move from level 5 to level 4, there are some people going back to work. Not everyone, but some people are going back to work. Some have already, of course, been at work in essential services. But all the HR people that I've been speaking to have been exceptionally busy writing out and putting together policies and processes around compliance and around health and safety. So it's such an opportune time, Renee, and we're so glad that you could join us today. I know your business partner, Lucille, was going to join us today, but you are one of those companies that have become even busier during this time. And so she's off doing an induction for a client. So I'm glad that you're still able to join us.
It's a pleasure.
But maybe for those who are joining, and it's wonderful to see everyone, Tanya and Vicky and Ryan and Adrian, and I know Roshan is here as well. Welcome. Please do post your questions in the chat. Please post your comments. Please post your questions in the Ask a Question section below. And Jennifer will be monitoring those and bringing them up every now and then. And at the end, we'll have a chance to answer those specific questions. Well, Renee will be doing that. But Renee, maybe you could just start off by letting us get to know you a little bit better. Please tell us a little bit about your background and what drew your interest into this industry.
Hi, everyone, and thank you for having me. You said specialist. I know if you in the industry for more than 10 years, you considered a specialist, but sometimes I still feel like I'm learning every single day, which is important because that keeps you on your toes. I started with behavioral psychology, and then when I had to write my thesis, I decided I'm going to focus on behavior in the workplace. And at that stage, behavioral health and safety in the workplace wasn't a big thing in South Africa yet. There was only 2 or 3 specialists that actually wrote something about it, and I decided I'm going to write my thesis on that. And the one person that was my mentor kind of drew me into the industry, and I decided I'm going to forward my career in health and safety instead of going further in psychology, which is lovely because I'm very passionate about what I do. I'm passionate about this industry. I'm excited to make workplaces healthy and safe for employees and to protect the environment for future generations. So that's kind of how I got into this. And I've been working in this environment for about 11 years now with various industries, which includes manufacturing, agriculture, food processing, even shops and offices and malls. So there's no sector or sphere that you wouldn't use health and safety in, because everything is about health and safety in your occupation.
Yes. No, interesting. And I think you're very lucky. You're probably one of the few people who finds their passion and interest so early on in their career. Most people save that for later. So I'm really glad for you that you've been able to become a specialist in such a short time.
Well, I learned very important lessons, and I think if there's something that I can convey to my own children and other people's children, is that if you can study and work while you are studying, you're actually going to have best of both worlds. So for some, there needs to be studying before you can actually practice what you have learned, and for some jobs, you actually need a degree. But if you can find that balance, it's quite important, because you'll already give yourself a very big kickstart.
No, sure. So I know that you're saying, so in your day-to-day, what you're normally involved with is helping clients to draw up policies, processes, implement, apply legislation, and all of the important key issues around occupational health and safety. But of course, now it's become under a spotlight with COVID-19 and everyone going back to work. So,
Yes.
Lerinay, maybe you can start off. I know that you did tell me with the Government Gazette had brought out some recent updates on COVID-19 compliance. So maybe you can start us off in the thick of it and tell us a little bit more about what those most recent updates are about.
Well, everything that's gazetted and everything that is currently written in the Occupational Health and Safety Act is viewed as minimum compliance when it comes to your workplace. So whatever they gazette doesn't replace what is written in the Occupational Health and Safety Act, which is kind of like, for lack of a better word, our Bible. It doesn't replace it. It is in addition to it. So whatever you would have had to comply with in the OSH Act, these things that they now promulgate are extra items that you need to comply with. So one of the main things that's written in the OSH Act in Section 8 is that the employer has a duty to provide a healthy and a safe workplace to their employees. It doesn't necessarily give them detail on how to do it, but it says things like you have to identify risks, you have to implement mitigating measures and controls, you have to do that before you allow people to work. You have to communicate that information to your employees, because they need to understand the risks and they need to understand the controls that's protecting them. And then you need to give them supervision and training in order to make them competent for the work that they'll be doing or for the circumstances that they'll be working in. The recent Government Gazette promulgates, in addition to that, extra measures that needs to be taken, specifically focusing on COVID-19. So that includes things like you have to have a COVID-19 risk assessment. We would call that an issue-based risk assessment, because it specifically focuses on one issue, and it's not necessarily a one-liner that you will slot into your company's baseline risk assessment. It also requires that you have a workplace plan. So that's basically a whole document where you summarize what your procedures are for people coming back to work. And these would include things like, are you going to screen people when they come through the door? Who's going to screen them? How are you going to record what you've screened? How are you going to record people's symptoms? Because you need to keep track of everything. Who's going to be responsible? Who are you going to appoint? Because you need to appoint a spokesperson or a responsible person for your workplace. It includes things like PPE. You have to give people masks. The ideal would be a reusable cloth mask, because with medical masks and that N95 masks, you should actually, after every use, discard of it. It explains things like issuing sanitizer, gloves, how you are going to keep the office clean. So that whole workplace policy is basically your how-to guide for when people come back to work. And in those regulations, they still say, in line with level 4, you only have to try and bring back 30% of your staff or a third of your staff for bigger companies. And they tell you that you must still motivate a work from home policy where it is possible.
Okay. So, Lerinay, with what is being promulgated and with the clients that you are working with currently, and the clients who are approaching you to say, hey, please help us, what do you find that companies are doing really well already?
I think what we found, and with some of our clients, is, first of all, they've realized that they can do a lot by using technology.
Okay.
in general, people would have been in the office. There would have been boardrooms full of people, meetings. You would have had to travel to clients. Now, all of a sudden, people realize that there's technology that they can use to their advantage, and they can still accomplish what they need to accomplish without having people in the office. So for them to only have a third or 30% of their staff back at work when it comes to office-based employees isn't really a headache, because they know that they can use Teams or Zoom or whatever application is available in order to conduct meetings and to catch up and to discuss important things when it comes to operations. So that's one of the things that we've realized people do really well. And then secondly, I want to say jumping on the bandwagon and wanting to comply. So the first step is them contacting us and saying, hey, I know there's some rules. I'm not sure about all of them, but I know that I have to comply. And that's something that companies have been doing really well as well. They want to comply. They want to do the right thing, and they're very focused on that.
Okay. And I think something I have noticed is, as I've been speaking to our different clients, it's usually the HR people that I'm speaking to. And what I'm hearing from them is that they are being shouldered with most of the responsibility for making sure that, that there is compliance. And they're taking that on as part of their role, but they're also telling me that sometimes aspects of that would normally fall under compliance or might fall under, legal or finance or something, are ending up with them. Who do you find is shouldering the responsibility for communicating, training, implementing everything around health and safety and compliance?
I'm going to agree with you there, that it's HR. And for some or other reason, everybody just decides, but this is HR's baby, which is not the way that this should be dealt with when it comes to the work environment. Because essentially, if you already have a health and safety structure in place, let's say you have health and safety reps and you have either a health and safety manager or someone who's a representative of the employer looking at health and safety, those people have to form part of the bigger solution, essentially, because when it comes to policies and aligning what we are doing for COVID-19 with our current HR policies and our disciplinary code and any existing procedures HR has, the enforcement and making sure that it is actually implemented falls back to the people who has been responsible for health and safety all along. And I think people make that division because they think, oh no, but this is a health issue and it's not really our problem. We're focusing on safety, but they forget the Occupational Health and Safety Act is about health and safety. So I'm agreeing with you on HR having to shoulder most of the responsibility, and that's not ideal because the implementation and the checks has to be done by someone apart from HR who finalizes the documents and checks that there's compliance in terms of the basic conditions of employment and the Labor Relations Act, etc.
Okay.
Speaking about compliance, we've got really interesting questions, and I would love to just jump in and go there before we continue. The question is from... You're welcome, Jane. So the question is from Roshan. Did I pronounce that correctly, Jane?
I think so. Hey, Roshan.
I hope so. What do you advise for employees older than 60 and those who have underlying conditions? Do they return to work or do they stay at home?
The requirements of the promulgated regulations are, number one, that you have to, as part of your risk assessment, identify at-risk groups. Obviously, HR is privy to some confidential information from employees. So what some of our clients have asked us is how do we identify who's at risk? And the easiest way to do that, apart from obviously knowing someone's age, is to send them a document that we call a declaration. So where they have to say, for example, I'm 60 or I'm 58 and I have diabetes or I am asthmatic, even though it's under control, or whatever other conditions they might have. They send that to you, you confirm that it's confidential as part of the employee file, and that's the easiest way for you to identify it. Plus, have a proof that you did identify it. That's the most important thing, because when, let's say, someone from the Department of Labor comes, they want to come and do an audit, the first question that they might ask you is, where's your risk assessment and how did you identify at-risk groups? Then the second part of that is, do they go back to work? It's recommended that people that are in a higher age group and that has comorbidity rather remain home and work from home as much and as far as possible. If they do come back to work, it's very, very important that every single step of preventing their exposure is taken, that they are issued with PPE, that they understand how and when they must use it. So all of the next steps have to follow that if there's no chance for that person to continue working from home.
Okay, well, that was something that I was wondering about myself. So it's very interesting to know. So the second question is, the regulations are not clear on who must wash cloth masks. It says make arrangements. What do you advise?
It says that the employer must make arrangements. So that can be interpreted in many ways. One of our clients decided that they are going to have people remove the cloth mask that they are going to be using at work. They are going to be leaving it at their desk in a container with their name on it, and the company has sourced a laundry company, a small one, but they are going to be washing each mask separately. I don't know how you're going to control that, but washing each mask separately, and they're going to iron it, and they're going to place it back into the container after the container has been cleaned, and then it's going to be taken back to the office every single day. That's why you have to issue people with 2 masks, so the one day you use the one mask, and while it's being washed, you can use the other one. So that was one of the measures that the company took. Another company said that is an administrative nightmare. They would rather not do that, which I kind of agree with, because it's very difficult to control. I mean, for all we know, the company that they use just irons the mask so they don't wash it, or they don't clean the container that the mask was in. So there's very little control there, and this whole pandemic is all about control. So they decided they're not going to go that route. They are going to inform each employee how they must wash their mask when they get home. They're going to give them the soap to do that. They're going to give them step-by-step instructions and on how to wash, how to iron, how to dry, how you must store it, how you must take it off after you've used it, etc. And they're going to make it the employee's responsibility. And obviously it's the employee's responsibility to bring another mask on the next day when they come back to work. They do also foresee that people might forget their masks, because it's advised that when you get out of your home into your car and you drive to work, unless specifically required that you wear your mask while you are driving, you leave your mask off, and when you get to work, you put on your mask and you have it on for the entire day, and you take it off after you left the office. So that's how you're actually supposed to use a mask. But they decided, and they foresee that people might forget their masks, so they decided instead of just issuing 2 masks, they are going to be issuing 4 masks. So there is backup in the office, and each person has their designated masks.
So it seems to be something that really should be done in concert with somebody who's quite knowledgeable about all these things, like your company. And with that, I'm going to give you right back to Jane, because I know we've got a ton to go through. Thank you so much for the questions. Feel free to ask some more. It was a very interesting, great question.
Yeah, I agree with you, Roshan. I see you're saying you prefer the second option. I also think I prefer the second option, and it is a good idea to have the backups. Just something that I find is coming up quite often, Lorene, is also about the mask itself.
Yes.
So I've seen a couple of videos on, that the mask needs to fit tightly around this part of your face. It needs to come under your chin. I've heard different options. One needs to be 2 layers. It needs to be 3 layers. You need to, make sure you hold it here when you take it on and off. I mean, in terms of the workplace, what is the regulation around what that mask must actually be made of, or how it must be made, or how it must fit? Are there any specifics around that companies need to be aware of?
They did release, from the Department of Health, they did release sort of a spec for people who are going to be making their own masks, because all of a sudden there was this whole explosion of everybody making masks. And you see very interesting masks. Like the other day, I saw someone advertise a leather mask, and then you get a filter that you insert into the leather masks. But if you look at what government suggests, that would not necessarily be compliant. Government specified that your material mask should be at least 3 layers thick, and you can make one of those layers insertable and removable filter, so obviously the middle layer. And then they also say it must be made from a breathable material, and they advise cotton, or I don't know what's the English word, but ongebleikte linnen. I don't know what's the English word for that.
Is that linen?
Yeah, but like, you know, the soft linen, because some linen is hard and scratchy, you get another one that's soft. So they advise that it has to be breathable material, and it has to be at least 3 layers thick. And it's important that they release that, because obviously the different people making masks, everybody seems to just follow whatever, unbleached soft linen. Thanks, Roshan. Everybody just seems to follow whatever they feel is going to look nice, which is not the ideal. Then in terms of how your mask must fit, when you have your mask on your face, I don't have a mask with me now, but when you have your mask on your face, it should fit snugly on your face, and it should fit snugly like this around your face, because the any openings allows for air and obviously possibility of the virus going to go into your mask. So whenever you use it, it should fit snugly around your face. And the way you can test that is if you have it on and you go like that inside the mask, you feel how much air comes out where, and then you know if your mask is a good fit or not.
Okay.
And then you asked about putting it on and taking it off. I can't remember.
Yes, well, I know there is a specification around you're not meant to touch it.
Yes. Well, basically, it's putting it on. Obviously, you put it like that, and you put it over your head. Taking it off, you don't touch anything. You take it off, and then you move it away from your face, and then obviously direct into the washing machine. Or if you're going to put it in the bin, it must be something with a lid, because the virus can still move freely. What I did also, we got a few queries of people saying, what if I have to eat lunch? So let's say you're going in your office and you're going to sit like this, you have to eat lunch. The ideal way is to take it off, put it away from you on either in a container, you can put it in a container that you can close, or without disturbing it too much, put it on a piece of that paper towel, put it there, eat your lunch, wash your hands, and then put it back on again without touching the front. And then every time before you put your mask on or take it off, you have to wash your hands. I saw yesterday when I went out to the shops, people wear it when they are in the shop, and then when they get in their car, they push it so it's down here. Not supposed to do that. You're supposed to keep it on until you take it off completely.
Okay, interesting. Yeah, I think there's a lot of regulation around that, and that's true, because people, if they're going back into the office, of course they're going to want to eat and drink. I mean, people are so used to just having their cup of coffee next to them as they work, or going and making coffee with everyone, or making lunch together. So there's a lot of changes around that.
Yeah, people have been asking, if people come into work, do they need to wear the mask in the office as well? Yes. So if you come from home, out of your car into the office, doesn't mean that you're in a safe environment now. You are working with other people. So you'll have to wear your mask. And that's why the social distancing and the capacity rules for kitchens and things like that is very important. And people also forget that the virus can survive for periods of time on a surface. On those blue surgical masks, for example, if I use it today and I take it off and I put it in the garage in a container, the virus can still, in a viable quantity, which means it can still infect, survive for at least 7 days on that mask.
Wow.
Yes, and with those masks, obviously you can't wash the surgical masks and you can't wash the N95 mask. So people ask, what am I supposed to do with it? You have to put it in a container where it's exposed to heat or a warm temperature and fresh air for 7 days, and then only it would be safe for you to reuse that mask. And that's why the government suggests reusable material masks, because it's easier to rotate and easier to clean.
And with that filter you were speaking about, so if you have for example, a mask with 2 layers, and then you have your third layer is the removable filter. Is that removable filter is that also meant to be something that can be washed and ironed or discarded, or?
Well, if you use a bamboo filter, you get like some people, or a liner, they call it a liner as well. And some people have used the same liners that you would use for babies who wear cloth nappies. The same liner as a filter in their, obviously, hopefully not reusing, but hopefully a new one. But they use that in their mask, and then afterwards you can wash that and iron that as well. So the ideal would be that it's reusable as well. Otherwise, can you just think of the amount of waste that we're going to generate if you think ahead? But I know some people also use a wet wipe, like a dried out wet wipe. That you can also wash a few times and use, but I think after the 3rd or 4th wash, it's not going to be effective as a filter anymore.
Okay, that makes sense. So it's a lot of work.
It is. That's why the whole, there's an admin, and that's why people call it an administrative nightmare. And it's also going to be very difficult to police people, because it's a new thing that we all need to get used to. And it's going to take some time. So there has to be someone who develops, and someone who implements, and someone who enforces and checks.
That makes sense. I think Jen has another question for us. Jen, is that why you're popping up?
Popping up like this, yes. This is very interesting. Yes, it's a very interesting one. It's from Lindy, and she says, do we need to keep a record of every person's temperature, ID number, and contacts number that comes onto the premises?
Lindy, yes. One of the requirements of screening, and you need to be able to prove how you screened and who you screened and when you screened them. So what I've done for one of our clients that I'm busy with their documentation, or I've been busy with them this past week, is we developed a short little register where they write down their name, surname, their ID number. You have a tick box for symptoms. So if it's someone who is a receptionist, it doesn't need to be someone that's medically qualified. They just need to know if you're going to temperature screen, how to use that machine, and they need to be able to fill in the register. It's better that they fill in the register and not necessarily the person who are being screened. But if you allow that person to fill in the register, obviously there needs to be a sanitizing process before and after. And then you basically have to record their symptoms, and you have to record their temperature as and when they entered the office on every morning that they come to work. For temperature, people have been asking what they must use. The best way is to get one of those handheld devices that you can be further away from a person. You get some that you have to be 1 meter away, some that you have to be 2 or 3 meters away, some that's handless, so someone just stands in front and it takes the reading. Obviously, it all depends on your budget as well, which will be taken into consideration when they measure your compliance, and then that has to be recorded for each person as well. It's going to be important for your own employees, but at a stage where we get contractors and visitors and people coming into the office again, that's also going to be very important, and it's probably going to remain a requirement until the infection rate has leveled out, or we have a decline in infection rates. And because you're basically going to be the first screening of people when they come to your office, and you would be able to pick up if someone might have underlying symptoms and then escalate it to either their doctor or through the hotline or whatever the case might be.
Okay, excellent. Thanks. Jen, were there any more questions that you wanted to raise before we continue? Nothing. Well, if there is, she'll appear. But there is a question that I had from an HR, a senior HR manager the other day, Renee, and that was around the 60 years old that I think Roshan raised. And they're in the retail environment, and some of their very experienced store managers who, really need to be there from a work perspective, and just in terms of business and economy and making things run. There's not really somebody who can replace those people, but a couple of them are maybe 60 or just over 60 or just turned 60. They are fit, they are healthy, they are competent. But I think they had some concern around whether they are going to be allowed to continue coming to work. With that 60-year-old regulation.
Let me give an example of what one of my friends are doing. They also have a operational manager who is 61 now, very healthy guy. And what they decided is he needs to be there for operational purposes. He's technically the only person that has the know-how and expertise. And they decided that he must be back at work, but he's mostly going to be isolated. And if he needs to go out and be in contact with employees, they got him the best PPE that money could buy, which he uses. And then obviously they have a social distancing policy for him of 3 to 4 meters, and he is the only one that uses a kitchen and the only one that uses a bathroom. So they kind of try to separate and isolate and quarantine him even though he is at work. So that could be a way to move forward, especially if there's no signs of extreme risk or comorbidity or anything like that. That could be something that they could consider. So implying the measures that's been promulgated, but on a stricter scale, as if the person is still working from home and no unnecessary contact with anyone.
Yes. Yeah, which I think is definitely challenging in a retail environment with food and clothing. But I hear you. I think, maybe there are things that they can do just to be able to minimize that person's exposure or manage the risk.
Their awareness as well around themselves. I mean, yesterday when I was in the shop, I realized how many things you touch and then you don't even realize it. But now you kind of have to. I said to my husband, I want like a lanyard with a little bottle here around my neck. So every time I touch something, I could immediately sanitize my hands. It sounds crazy, but it's kind of going to be the way we have to think about it for the foreseeable future. Look, we all wash our hands, but the touch and then walking around with your hands, touching other things, that's a mindset that we have to change. And in retail, for example, yes, he is going to be on the floor. Yes, there might be contact, but social distancing can still apply. But he has to, or she has to, have that mindset of, oh, I touched something now, I have to sanitize before I move on to whatever I'm doing next.
Yeah, great point.
Just on a relevant point, and you got it. Quick look at my huskies back there. They always come in and out while I'm talking. What is the temperature? What is the temperature that you're looking out for that is dangerous, where you say to someone, sorry, you can't come onto the premises, you have to go home, you have to see a medical professional?
That's something that has to be part of your workplace procedure or plan as well. Just FYI, you have to determine how you're going to deal with a case when someone is on your premises, they are showing some symptoms, and then what you are going to do or have to do in order to prevent other people's exposure, and how you're going to treat that person and make sure they get the necessary medical attention. But the recommended temperature from our government is 37.5. So if you are screening someone and they have a fever of 37.5 or higher, then you take that as a fever symptom. Then someone asked me, well, what if it's 37.4? What some of our clients have decided to do is they're going to make the range 37 and higher. So if someone has a fever of 37, that's going to be the baseline that they are going to be working on. But government recommends 37.5.
Sorry. Okay, that's fantastic. Thank you so much. I was typing while you were talking, so I said range 17 degrees and higher. It's 37. I'm going to correct it in a moment. Thank you so much. That was super interesting. Sorry, all back to you, Jane.
No, excellent. Thanks, Jen. So, Lorene, we've discussed, who's shouldering responsibility. We've discussed the intricacies of the masks, and I think there are particular areas that companies are finding it very difficult or more challenging to implement under the regulations and under the updates. Which other areas besides the ones that we've discussed are ones that you're finding clients are really struggling to implement or finding very challenging?
I think one of the biggest ones is social distancing. Bigger companies might be easier in an office environment because they have bigger spaces. So if there's only a third of their employees coming back at the moment under level 4, it's not difficult to create a 2-meter social distance between employees. I mean, if you have the space, great. But for smaller companies, it's a bit more difficult. I have friends, they have a design studio, and they're about 10 people in there, and it's not necessarily like they have the space in order to be able to create it. So that's sometimes a challenge, and people really have to put their head around how they're going to figure that out for the time being, and I think for the foreseeable future as well. So that was one of the issues, and also how to enforce it. Like if you have a break room or a tea room, let's say you have a capacity on your tea room of 1 or 2 people. People have to act like adults now, and they're going to have to police themselves. And that's unfortunately in South Africa and in health and safety a behavioral issue that we struggle with. If we implement a rule, people go, why must I comply with this? It's just wasting my time. But here, you actually have to comply with the rule because it's for your own benefit, as with all of the other rules and requirements. So the enforcement part, everybody asks that question, how am I going to enforce this? How am I going to make sure that people stay away from each other and they don't sit together at break and they don't share a cigarette when they go into the smoking area? How am I going to do this? What I do advise employers is you make sure that you have covered everything that you need to cover and you have proof of that. So if someone does unfortunately contract the virus, and they might have contracted the virus while they were at work, and for some or other reason they blame you for not implementing all the necessary requirements, then you have something that you can backtrack onto and say, but you were inducted. The rules were explained to you. There's signage. You signed a declaration where you agree that you understand what our measures and our mitigating factors are. And you signed that you understand what the risks are. And that you as an employee, and this is back to the OSH Act, agree that you are going to take care of yourself and you're going to consider how what you do is going to impact on others as well. So that's why a paper trail and making sure that you dot the I's and cross the T's is very important when it comes to compliance. And then I get a lot of questions on what is consequences of non-compliance. People aren't sure if they aren't complying, what would be the consequences. Well, in this case, there could be various consequences, including criminal cases. The area on that is very gray, with legal issues. There's not really always a black and white. It's based on a balance of probabilities when it comes to the OSH Act and everything in relation to occupational health and safety. But you have to prepare yourself that there can be legal consequences if you are not compliant. And then there's another one on how am I supposed to inform employees? How do I do training? How do I communicate it to them? My advice there is always just, if you do use an induction, do it through a presentation or a video and make sure that it's short and easy to understand. And then make sure, again, that people sign in agreement that they understand what you've communicated to them.
And I agree with you when you say that, you can do it through a video. I think more and more people are moving towards using video technology and, different type virtual reality, all the kind of technology to be able to communicate company policies, processes, and even more so now. I mean, you can't have a physical person standing up in front of a group of people. I think that is very helpful. Are there any other questions from the side? Otherwise, I know something that you'd very kindly said you'd do, Lorene, is send everybody a checklist for them to be able to go through and see, okay, have I covered all of the areas that I need to cover to make sure that I'm compliant under the COVID-19 regulations? But perhaps when they receive this checklist, I think people are at different stages in terms of, setting up their policies and processes and communicating, implementing. What's the kind of best practical way to go about it for people who are just starting off and putting this together and trying to think, okay, I've got to implement this and I'm HR and everything has landed on my shoulders?
Start at the top and finish at the bottom. In terms of importance, I would suggest people include COVID-19 in their health and safety policy or their company policy. Basically, it's a commitment that employers are going to protect their employees. So that's number one. Number two, do a risk assessment. And number three, have a workplace plan where you stipulate what you're going to do and how you're going to protect people and include everything with regards to screening, PPE, sanitizer, how you're going to clean, and what social distancing measures you're going to implement. Those are the top three things that you need to implement. And then the fourth thing you have to ensure is that you communicate whatever you write down in your risk assessment and your procedure with your employees through some type of induction. If it's a video, it's fantastic because then you can WhatsApp it to everybody or send a link to everybody via email, and people have access to that all the time. Even if they're unsure about something, then they can play that again, refer back to it, and it's easily accessible. So those would be the first things I would recommend people start with if you're going to start your journey on compliance when it comes to the COVID-19 regulations.
No, I think that's very helpful to kind of, okay, where to start? What are my top 3 or 4 points? And I think it's so important as I'm just coming into contact with people. I mean, I'm not in a workplace, but I think as I'm coming into contact with different service providers, I'm finding that it's not only around people being self-aware to protect their own health and safety, but some people are in a position where maybe they're younger and fitter, and so they're not as at risk as others might be, but they're not very aware around complying so that they protect others. I actually came across a service provider this morning and I was like, so, what happened to the mask? And he's like, oh, I thought I'll risk it. But it's not just about him. He's, young and fit. But I mean, he's exposed to different households, different premises. We can be carriers. And I think people need to understand the burden of responsibility. It's not just for me. It's for who I might come into contact with, who might come into contact with someone else. So we're responsible for each other.
That's a very good point. And especially with everybody going back to work and people or kids going back to school, it's easy to say that there are some groups that are not at risk, but groups that are not at risk can also be carriers. And if you go out to the office or to school and you come back, you are exposing your family. So it's important to realize you can't be selfish when it comes to COVID-19.
Oh, absolutely. I see there's a great question from Johan, which I'm assuming Jennifer has appeared. So Johan is saying, what obligations do? Is it that one in the chat box, Jen?
Yeah.
Yes,
What
absolutely. Absolutely, yes. So what obligations do companies have to digitize these processes and retain these auditable records?
Digitizing is obviously going to be a new norm because people aren't in an office. You can't necessarily just print something out. So in order to just ensure that your records are valid, make sure that there is an electronic signature, or that you offer people an option of making an electronic signature, whether it be their signature or whether it be them typing their name out, and then having a disclaimer saying that even though you type your name out, you agree that that is your signature. So it would be obvious that we have to digitize because we're not in close proximity to each other, but just make sure that that record that you are keeping is valid. Then the second question you have is to retain auditable records. With everything in occupational health and safety, you have to, for most of the documents or processes or controls that you implement, you have to retain proof of that for at least 3 years. So if you're going to do induction training and people are going to sign a declaration saying that they understand this, it is, number one, a requirement, because how else are you going to prove it? And number two, it's a requirement that you retain the records, not only to prove your compliance, but should you at a later stage want to demonstrate your compliance through an audit, that there is documents for us to verify. And that's something that I'm actually very excited about, because now with everything being digitized, we can actually conduct record audits without being on site, which is fantastic. And secondly, there's a new motivation to virtual walkabouts, which I actually did for a client the other day, which is really cool. And what's nice about that is, even though they think that they're not going to show you everything, you know the operation. So you say, go there, point the camera down, turn right, turn left, point the camera up. So it's quite a new and innovative environment in the occupational health and safety sphere that we are moving into. So that's very important, Johan, and it's a very valid question.
Extremely. So we have about 13 minutes left at most today. I know Jane still has one more thing she wants to discuss with you. So our audience, thank you for being so involved with us today. If you have any last minute questions, now's your time.
I think something I actually wanted to feed on from Johan, what you'd mentioned, if I'm not mistaken, my understanding is that you also have a device that is able to track people and the contact that they've come into, in terms of their movement, so that if somebody does test positive, then it's a lot easier to be able to find out who they were in contact with, so that those people can be, more self-aware. So, if that is correct, if I am on the right foot there, I think Lerene is a great person to connect with in terms of that. And please feel free to post a link to more information around that if you'd like to on the there we go, Safe Trace. So please do post a link to that, Johan, in the chat box, so that people who want to find out more information around that can. And I know that we were also speaking to Alman Lamprecht a couple of weeks back around VR and those kind of 3D tours that you can do of companies that Lerene was referring to, which I think, it makes it a lot more interesting and engaging than a 2D presentation. So, but Lerene, so any other pointers that you would like to share as we close out on, particular questions that clients have asked you, or advice, tips that you would like to give people who are embarking on this journey that we haven't covered so far?
Well, I think one of the main things is that people should remember that whatever is minimum compliance you have to comply with. There's no getting around it or getting away from it. And even though administratively we're going to be dealing with a lot of documents and records, just as we discussed, it's important to retain those records. And then what I also would advise is, if you've implemented, and we tell this to all our clients as well, if you've implemented any measures, you can check yourself and audit yourself, but it's always good to have a third party come in and do a verification or do a virtual verification to see the effect of whatever you've implemented in order to give you an unbiased opinion. Because obviously we're all, for some part, not sure about what exactly we need to do or how we need to do it. Some people just play it by ear, and that's a very good starting point. If you have implemented everything and you want to make sure that you're on the right track, that you get someone that's unbiased to look over it and give you feedback on it, and valuable feedback, even though it might be negative, or positive criticism where you can improve on, because at the end of the day, we want to make sure that you are compliant and that you keep everybody safe. I don't think, and this is why we give legal liability training to a lot of employers. I don't think employers understand how big a responsibility they have. If we do legal compliance training with people and I explain the term vicarious liability to them, everybody's eyes go big like this. And I usually use the example of me having a child and my child being in school, and the principal phones me and says, your child just graffitied a wall and it's going to cost you 3,000 Rand to repaint this wall. I'm responsible for my child because they're my child. In exactly the same way, the employer is responsible for what employees do when they are in your employment and when they are doing work for you. Obviously, there's some parameters. If people act outside their scope of authority, it won't necessarily be the responsibility of the employer, but the employer has a very big responsibility, and that's why it's so important to get things right, or try to get them right the first time.
No, absolutely. That makes sense. So it's a huge responsibility and very difficult because, as with all things, we can't control anyone else. The most we can control in this universe is ourselves. So we can also try our best, and people have choices. And so, and the choices have consequences for other people. So.
It's going to be interesting from a legal point of view. We had the discussion the other day. My husband's an advocate, and we have a lot of friends who are either advocates or lawyers, and we had a discussion about if someone infects you, do you have a civil claim against them? And if it was due to negligence, the term delict, if someone, it's going to be a very interesting time from a legal perspective as well, because this is kind of in most cases, a life or death situation. So I'm wondering how all of that will play out as well. And that can also be applicable in the workplace, because there hasn't been a specification. Obviously, if you are at work, you get ill, the treatment and everything will be handled through COID, because the employer pays their annual fees. You go for treatment, the employer claims back from COID for your medical treatment. But the whole legal implication of pain and suffering, damages, delict, it's going to be interesting to see what the civil play out of this is in the sphere of law.
Absolutely. And do you know of any cases so far, or people wanting to hold somebody else responsible for their infection from a legal perspective?
There is actually, it's closer to home, but yeah, there's someone who suspects that they contracted the virus, where everything they did well, but the other person kind of took a risk, and they're considering their options, because what essentially happened was they became a carrier and they infected one of their elders, and one of those people passed away. So it's a difficult topic, but it's going to be interesting to see what the legal developments are around this. And that's why I implore employers to make sure that they are compliant, because this is a whole new level that we don't know what the outcomes are. Nothing has been determined yet.
Absolutely. Yeah, we are in unprecedented times, and so that impacts every sphere. As you say, now one of them is also the legal, and we'll be looking at the precedents in terms of future cases and how things get handled. So, yeah, very interesting. Jen, you've popped up. Is there another question?
No, I've popped up because we've unfortunately reached the end of our day together, or
Okay,
our hour
thank you.
together. I just want to say again to Lirene, thank you so much for this. Has been so informative. We're going to download and post this on our YouTube link as soon as possible. Share it with everyone as soon as we can, because this is the kind of questions that everybody's going to be asking in the next week or two, and it would, as you say, usually be the HR professionals or the HR department handling this. Also, thank you so much to everyone who engaged with us. Johan, so interesting. Thank you for all your information. We're going to also put that on our links when we post it on our Facebook page and when we post it on YouTube.
Thank you.
Over to you, Jane. I'm just going to sit here watching you all say goodbye.
Okay, well, bye, Jen. Thank you. But thank you very, very much, Lirene. We really do appreciate your generous sharing of your knowledge and expertise. And I think, as we were saying yesterday, it's reassuring to hear what other people are doing and what other people are struggling with. Because in this time, so many people feel alone or nervous about how to navigate it because, what could I, as you say, I mean, we can self-evaluate, and thank you for sharing that checklist that people can use to self-evaluate. But it's really helpful to hear what other people are doing, to hear your expertise and your perspective. And as you say, to be able to then get in an objective party to say, okay, please just audit what I've done and make sure I am on the right track. I think that's very helpful. So thank you, and good luck for this busy, busy time that you're involved in, and for the good work that you're doing and helping companies and helping us all to be safe as we return to the workplace.
Thank you, and thank you for having me. I really appreciate it.
Jane is on mute, but I think she's probably saying goodbye. And we will post. Jane?
Yes, absolutely. So, yes, absolutely. We'll have an HD copy up by tomorrow. Thank you so much for joining us today. Thank you, Lirene. Goodbye.
Bye,
Jane.
Bye-bye. Thanks, everyone, and thanks for your comments and for your questions. Bye-bye.
Bye. See you in 2 weeks. Bye.